It's a fact that there have been more people on hospital trolleys during the watch of this government, these so-called days of recovery, than under the darkest hours of your predecessors. And I really think that the counter-motion put forward by the government here today, in essence trying to blame citizens for getting older for the crisis, is utterly ludicrous. There are people on trolleys because they can't get beds. Doesn't take a genius to work that one out. The reason they can't get beds is, on the one hand, there's not enough of them, but also a critically important factor is that there's nowhere for people to go when they finish their hospital treatment. And there's two reasons for this. Firstly is the essential privatisation of care of the elderly and the nursing home provision in this state. It's now big business to be profited from. The care of the elderly is a secondary factor. The other reason is the vicious cut in home help hours and the failure to provide adequate care to allow people to remain in their homes. So what's the consequence of that? Every day there's crisis meetings in all of our major hospitals to see who they can get out. It's not dictated by the medical needs of the patients, but who can you get out today so we can free up the bed to put somebody into it later on. And what that means is staff are under pressure to send people home without adequate care. I know of cases where people who were on oxygen, where pressure was being put on to send them home without the apparatus being there to administer and support their needs. All of us know from our own areas, we have representations of people whose parents are being sent to nursing homes way outside the jurisdiction. Maybe they don't have a car, they can't go and visit them because the private nursing homes can dictate what goes. They're there to make money, to make a profit, not to really be concerned about the care of the needs of the people in their care. Now, contrary to your... Sorry, Ceann Comhairle, Deputy Collins isn't coming, so if we'll share the remainder of the time, if that's okay.
Tell these guys that.
I said that we did. We told them. We all got text. I saw you getting agitated there, just in case. So, we'll share the remaining bit. But I think the important point is that the government have told us that competition will create more places, and there have been more places. But when the organisations that are running nursing home care are doing it to generate a profit, then that's a problem. And we see it manifest. There was an elderly lady in my own area. As she approached her 95th birthday, she was ready to go into a new state-of-the-art nursing home facility out beside Dublin Airport, Clare, near for the family and all the rest. But because of the inability to strike a deal between the state, the HSE, failing to reach an adequate deal with the private provider of that facility, virtually 90-bed facility, is still virtually lying idle. There's one full-time resident in it, and that has been the case for almost a year. We see former hotels in the ownership of NAMA being converted into nursing homes in Finglas to generate profit for the owners. We see business articles in the business sections of our newspapers lauding the business opportunities coming from nursing home care. Now, why didn't NAMA provide that facility to the HSE to run those services directly, so that when the staff in our hospitals are having their emergency meetings every day about where to send the people who are currently occupying hospital beds, that those decisions could be made on the basis of the interests of that patient being released to their family, and not the diktats of the muscle that's there for private gain in nursing home care now.
Thank you, Deputy Wallace.